Getting back to work post-COVID-19. I'm Dr. Jim. One of the worst pandemics in modern times has affected the entire world and in uncountable ways. We will be discovering ways that this crisis has affected the world years from now. Businesses have closed their doors. Millions of people have been laid off. Meanwhile, essential workers have remained at the front lines in medicine, healthcare, law enforcement, grocery stores, trucking, and it goes on. And we're very grateful for those people. Now that the number of new cases currently could change, is dropping, and hospitals are seeing fewer people with symptoms requiring admission, most states are starting the process of opening their doors, getting back to work. What will this look like? What might it entail? That's what I set out to examine, and I'd like to share what I have found with you. There might be some new norms. When people say the new normal, it kind of gets on my nerves. It's too soon to talk about the new normal. Most likely, though, personal protective equipment like face masks and gloves will be required in the workplace for some time in the near future. Universal precautions that a lot of us have been taught over and over and over again will become even more important. There will be new signage that will line hallways and walls, reminding us to wash our hands for 20 seconds or more, cough or sneeze into our elbows. Social distancing will also be in place and practiced as effectively and intelligently as possible. Some companies might even decide to take employee temperatures digitally while you're coming on to the next shift. And some may actually do rapid testing or screening as they become more available for COVID-19 before you go to work. Who knows? The use of space, I like space and room and how to arrange it ergonomically and feng shui and all those types of things. Offices are going to change a little bit, most likely. Desks will be spread out further apart than they are now. Some employees who go into the office every day might be lucky enough to opt out and not go to the office, but work from home either full-time or maybe they'll have a flexible schedule. Come into the office Tuesday and Thursday, work from home Monday, Wednesday, Friday, because that way we're reducing risk significantly. Many corporate offices that did away, this is almost, I think, humorous to a degree. A lot of offices were designed into cubicle spaces. And, the tone of business was that we shouldn't be putting people in little cubes. Tear down the cubes. Let's have wide open spaces with communal tables and communal spaces. Millennials love this type of thing. They don't like being put into a cubicle. They were raised to do things as groups, not individuals. Now, a lot of corporate offices might have to go back to the cubicles. From cubicle to open space, back to cubicles. Conference rooms will no longer hold a bunch of employees tightly squeezed in over a box of donuts, right? But you might have half of the amount of chairs in a conference room. Same thing with the employee break room. Think about that. Think about your break rooms. Do those have to be reconfigured to be more viral friendly? Companies may also, now this one I do like, invest in an air quality system within the work environment that increases the flow of outside air into the building and refreshes. It's like an airplane, or there are lots of examples that I could give you where the air is basically flushed out of a room and fresh air is pumped in every so often. Maybe companies will invest in those things. The flow of people might change as well. Think about your business. Visitors and vendors, family members, customers, so on and so forth that had free access. They may not have as much access to the workplace as they've had traditionally. They too might require temperatures before they enter your business. They might have to take a rapid test before they enter a building. They might need to wear a face mask or gloves during their visit. This might especially be true in healthcare settings for a while. Even employees may be asked to work from home if possible, not to overcrowd the workspace. So the amount of bodies in a space might be changed and reconfigured for a while. Bigger budgets for IT. That might be happening right now. And smart companies, you know what? You're going to make changes now, but my thought is, and I'm working on a program, it's like being prepared for the next wave. Getting ready for the next epidemic, the next pandemic, the next whatever, right? Bigger budgets for IT. Maintaining employee safety has a completely new meaning now, and many companies will decide who could work from home and how technology can reduce the risk of another outbreak. Will business office managers, customer service specialists, and marketing teams start working from their homes? I've worked with all these folks for 30 years. Marketing is face-to-face. We're eating lunch, we're eating breakfast, we're having coffee together, and I'm talking to you about our services. Is that going to be changed for a while? It might be. So, improving safety while minimizing liability. Big things will become a new risk management focus. Risk management. Training will become more important than ever before. I hope you embrace this. Perhaps most training and education will be provided online and virtually, reducing the need for large gatherings of employees in one space. I get it. Conferences have been wiped out all year. And there's still, things in September, October are being canceled. And I think it's a little too soon for that. But along with normal training topics, universal precautions, airborne, bloodborne diseases and illnesses, cross-contamination, emergencies and disasters, epidemics, pandemics, they might be the focus of more training and education now and in the coming years. It's smart to be prepared, to be better prepared. If anything, getting back to work means, what did we learn? And what do we need to change? And how do we need to prepare? Many employees may have had to forego their training requirements, and it's completely understandable. Working during a crisis, it's not like, hey, let me jump on here and get some CEUs and get my compliance training. I get it. But it is time. It's time to get back. Once, we flatten the situation out and things start to normalize and cases are dropping and, people still have Alzheimer's and cardiovascular problems and diabetes and elective surgeries and dental problems and mental health issues. We've got to get back. We've got to get back and help these people. Okay? So you may have had to forego your training requirements in order to provide needed care. And we're so glad that you were available to do that. But the time now and in the very near future is to get back to training and education. It's here. It's important. A big focus on cleaning and disinfecting, that is a big part of getting back to work. The post-COVID-19 workplace will be cleaner and healthier than ever before. Think about that. And I'm happy about it, and then I kind of cringe about that, because if you disinfect too much, are we not lowering our resistance to bugs and germs as well? There's a fine balance there. If one lesson is learned, people work indoors for the most part. So the environment has to be cleaned, it has to be disinfected, and we have to do this more efficiently, cost-effectively, and frequently. Employees may see cleaning teams in their workplace more often, if not in some circumstances, around the clock, especially in healthcare settings. You might see people cleaning the same surface every few hours. Here's my takeaway. While no one truly knows what will happen in the future and how the workplace will evolve during this pandemic, it's crucial to learn certain lessons from this crisis. We have to learn. COVID-19 is highly contagious and it travels rapidly anywhere there are large groups of people. But there are ways to return safely to work, and we have to do that through the use of PPE. How many of you didn't know what PPE was before? Personal protective equipment. Taking temperatures, rapid testing of staff, rearranging the workplace and the work environment, using space more safely, minimizing the traffic and the flow of people, using distance learning, staying more keenly informed, up-to-date, educated, cleaning and disinfecting the workplace more frequently. Through these methods, it's hoped that the workplace will be more prepared for the next crisis. I'm Dr. Jim. If you're not back to work yet, I hope you are soon, but take care of yourself and let's get back to normal as soon as possible.